வணக்கம், என் பேர் முகமது ஜஹீர். நான் ஒரு பீடியாட்ரிக் ஆக்குபேஷனல் தெரபிஸ்ட். மாஸ்டர்ஸ் இன் ஆக்குபேஷனல் தெரப்பி பண்ணியிருக்கேன் பீடியாட்ரிக்ஸில். எனக்கு ஒரு 15 years ப்ளஸ் எக்ஸ்பீரியன்ஸ் இருக்குது இந்த பீடியாட்ரிக் ரீஹாப் ஃபீல்டில். ஸோ டுடே வி ஆர் கோயிங் டு டிஸ்கஸ் மெயின் டாபிக்ஸ் விச் இஸ் ரிலேட்டட் டு டே ப்ராப்ளம்ஸ். இந்த லாக்டவுன் காலத்தில் பேரண்ட்ஸ் என்னென்ன ஃபேஸ் பண்ணுறாங்க, குழந்தைங்களை எப்படி மெயின்டைன் பண்ணணும், வீட்டில் எப்படி அவங்களுக்கு தெரப்பி ஹெல்ப் பண்ணணும். ஸோ இதை பற்றி வி ஆர் கோயிங் டு டிஸ்கஸ். வி ஹேவ் சம் செட் ஆஃப் கொஸ்டின்ஸ் விச் I am going to talk and I am going to demonstrate also a session. First, let me talk a few words about autism. Autism is a neuropsychohormonal disorder. It is a disorder, it's not a disease. Okay, there is a vast difference between disorder and disease. Hypertension, diabetes, when it is also a disorder, it's not a disease, whereas typhoid and cholera and corona is a disease. So most of the people, they think that kids with autism should not be touched or talked, and there are lots of community social implications and taboos. So this leads to the parents not coming out with the child for a diagnosis or a proper intervention. Autism is a disorder, childhood developmental disorder. This is what the main preview of the autism. It comes under the childhood developmental disorder. Autism consists of mainly 5 symptoms. These are the main 5 red flags which the child will exhibit that will help you for the diagnosis and the intervention further. Number 1 will be the response to name call. If the child is sitting in front of you or the child is turning away and standing, if you call his or her name, the child will not be able to respond. The child will not be able to turn, at least turn or say yes. The child will not be able to respond to name call. Second would be the eye contact consistency. Most of the kids with autism, they'll just look at you and just turn for a second, and many of them, they will not even look at you, they will just look down and they may reply or they may not reply. So the eye contact consistency is also the second issue. Third would be the age appropriate speech delay. There would be proper motor milestones achievement, but there will be problem with the speech milestone. Suppose a 2-year-old child has to talk 500 to 700 or 1000 words. The child will not be able to communicate fluently in that age category. The fourth would be the stimming behavior. Stimming is stimulating behavior. It can be self-stimulating or it can be getting the environment stimulation just to keep up the pleasure activity in the body. So this is the fourth point, that is the stimming behavior. Stimming again can be divided into 5. As you all know that there are 5 senses. There is going to be additional 2 senses which is vestibular and proprioceptive. Okay, so this is the fourth sign of autism. Fifth would be psychosocial skills. There would be a problem in psychosocial skills. Particularly the child with autism would have problem in mingling with the same age group. Peer group interaction will not be there. They will be very good with the kids elder to them or smaller kids. They will be very good to the adults. But when it comes to the same level, there will be definite difficulty in the initiation, in maintaining and finishing the conversation or say play skills. This is the basic first area where you put the child to a play school, and the play school teacher may identify that this child is not mingling. This child wants to play alone. The child does not come and sit in the circle time. The child does not share the kids toys and food with the other kids. So these are the red flags, alarms, which will help the parent or the teacher to identify about the autism. Now coming about the occupational therapy, how occupational therapists can work and improve the child's this kind of behavior. We have lots of frames of references. One among there, it is sensory integration. So I mentioned you the 7 senses: tactile, auditory, vestibular, proprioceptive, gustatory, olfactory and oral. So all the 7 senses need to be properly balanced. There should not be more, there should not be less. For OT will help to restore the balance between all the senses. In more simpler terms, there is just remember 2 terms. One is hypo, one is hyper. Hypo is less, hyper is more. Okay, so the sensory skills or the sensory modulation in the child will be more or less. Because of this, the child will not be able to properly function in the society. Because of this, the child will not be able to filter out additional auditory things. The child will not be able to go in a crowded place. The child will not be able to pay a response to the name call. So occupational therapy practitioner mainly uses sensory integration therapy as the basic instrument. There are other instruments also, but it is up to the clinical reasoning of the therapist which tool to use. But predominantly we start with sensory integration, then we move on to the other frames of references. Because as OT we don't have any big equipments to work on, we work with the tailor-made requirements of the particular child. This is how OT can work on autism kids. Okay, the one activity which is most important for the parents to follow is the Wilbarger Protocol. Wilbarger Protocol is nothing but you have a brush, specialized brush. In that you have to do the stimulation for particular amount of time and particular period in the day, and it should be followed by joint compression. I will be performing a demonstration how to perform the Wilbarger Protocol. We are going to work on the Wilbarger Protocol today. So Wilbarger Protocol depends on a specialized kind of brush you have to use on the tactile system of the child, so that the child's eye contact, response to name call, sitting tolerance, attention, concentration, everything will improve. So this is a proven study, and this has certain rules to be followed. Number one, it should be done on the body surface, and there are certain things where you are supposed to avoid it. For example, the face. On the face you are not supposed to do the brushing, and the necky region where are your superior blood vessels will be going, the chest, the abdomen and the stomach and the inner thighs you are not supposed to do. So these are the contraindicated. Likewise, on the back of your spine, the middle, the vertebral column, you are not supposed to brush. So you can do minimum from 10 counts to 20 counts, definitely you can do the brushing. So the child has to sit, and one more important thing is you must do from up to down. That is very important. It is from proximal to distal. All in medical terms we call cephalocaudal rule. Cephal is brain, caudal is your backbone. So from cephalocaudal rule, from up to down. This is very important, because if you do from down to up, the child is going to show different behaviors. So from top to bottom is the main activity. One, it should be firm pressure. It should not be very light. It should be firm pressure throughout the extremity. Like this you can do from minimum from 10 to 20 times you can do like this. Okay, and after finishing this, for palm alone you have to do again 20 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Likewise the same, 20 counts here, 20 counts here. That's it. Immediately start the joint compression. So here we have to hold on the scapula and the humerus. This is the humerus bone. You have to hold, you have to push towards the joint socket. Here you have to remember one thing, you are going to push towards the joint. This is the shoulder joint. You have to push, not to pull. See, this grease has to come. You must not pull it, you just push it. 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Likewise elbow, you have to hold the humerus, you have to hold the forearm bone, and you have to push up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Likewise the wrist. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Remember, I am not pulling, I am just pushing it. You must not apply traction. Then comes your thumb. Hold it proximal phalanx and push it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Likewise here. Likewise here. Likewise the ring finger and the little finger. Here you have to remember, it should not bend. It should be straight, and straight pressure you must give to the joints. This is the completion of a Wilbarger protocol of the upper extremity. Now we will move on to the lower extremities. One, I told you avoid the medial side of the thigh. So you can do like this, like this, like this. Same 20 counts you can do all over the lower extremity. You must not do on the plantar aspect of the foot. like how you did on the palm, you are not supposed to do on this foot part. The most of the practitioners, they do it, but it is not observable. It's contraindicated. After finishing this, same here also you have to do. From here you can start, 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 from here you can start. Okay, then comes the joint compression. We are going to do for the hip joint. This is the hip joint, this is the femur. You have to hold it in the 90 degree of hip, 90 degree of knee. Hold the pressure and give 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, like 12 to 15 counts you can do it. Then for the knee, again hold it here, relax Suresh, push, 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 push. Here while doing this you should not bend like that, it should be straight. You just have to push the pressure so that 1, 2, 3 together. Then for the ankle, again you have to hold it here. Either you can fold it like this and give pressure like this, or this is also fine. Keep your hand on the heel bone and push it. This is the Wilbarger protocol for the lower extremity also. Now we have to do for the back. Please get up. Make the child sit straight. Okay. You are not supposed to do on the spine. You can do on the back sides, lateral side of the spine. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the completion of the Wilbarger protocol for the back also. But even though the child may have all the signs and symptoms, there is no need to lose hope. In my this 16 plus experience, I have seen many kids who have improved and come out of autism also. Depends on the age where they are diagnosed and the early intervention. Early intervention is very important. So if you give proper therapy, properly you follow a diet, properly follow a structure at home and school, definitely the child can come out. There is no need for the parents with autism to be depressed or losing hope. Please keep trust, and it should be a teamwork where you are also going to be involved. You are the main person, because we cannot come and work at home. You are the one who is in control. So definitely, if you give proper therapy, if you follow proper guidelines from a registered occupational therapist or a speech therapist, there are lots of fake therapists around, but you must see which one is good, and with the pediatrician's recommendation or via the parents' word of mouth, you can go to the therapist and follow the guidelines. If there is any problem, kindly go and contact him or her for your personal issues with the child if you are finding difficulty while doing home program. But definitely there is a big ray of hope. Definitely the child with autism can improve and improve definitely. Okay.